Well, not so much in cardiovascular disease as coming from human studies, but in our own laboratory we have been studying the effect of the endocannabinoid system on blood pressure and blood pressure regulation, and found some very interesting evidence in a way that our results so far suggest that in animals which are otherwise healthy and have normal blood pressure, endocannabinoids do not really have a significant tonic influence on their cardiovascular function, blood pressure, heart contractility, and so on. But what we found is that in 3 different models of experimental hypertension, and rats with spontaneous hypertension, with hypertension induced by angiotensin infusion, or salt-sensitive hypertension, in all 3 models, the endocannabinoid system is activated as a compensatory mechanism with the aim to counteract the blood pressure elevation in these animals. Of course, the fact that they are hypertensive means that this compensatory mechanism is not strong enough, but it's there. Now, that means that if you block this effect, you get a further elevation of blood pressure, which we demonstrated in these animals. On the other hand, it also indicates that if you somehow are able to amplify this effect, for example, by blocking the enzyme that normally degrades the endogenous cannabinoid, and this way you elevate the level of the endogenously produced cannabinoid, that has the opposite effect. It can actually normalize blood pressure and reduce the inappropriately increased cardiac contractility towards normal level. So this, from our perspective, gave an interesting opportunity to think of developing such kind of drugs, that is, inhibitors of enzymes. In this case, the enzyme's name is fatty acid amidohydrolase. That's the enzyme that selectively degrades the endogenous cannabinoid anandamide. An inhibitor of this enzyme could theoretically be used to treat hypertension. And in fact, we have just developed a new antagonist for this enzyme, which is very potent. It's effective in vivo. We are currently submitting it for a patent, and we'll continue to explore its both not only its effectiveness, which we already established, but its possible toxicity for possible future human testing.